Eng Shetty. I'm representing a company called NSK. Before I start my short session, I'd just like to ask how many of y'all are using NSK products? Can you just raise your hands, please? Okay, good. Maybe like 40 or 50%. Okay, the reason why I ask this is year by year, NSK products are, how can I say, people are not that much aware, especially the new dentists. To be honest, NSK is a company which is from Japan and well known into this rotary instruments. And the main product of NSK is dental handpieces. In addition to that, we have other products such as micromotors, scalers, and laboratory equipments, implant motors, a range of products. But when it comes to handpieces, NSK is a company who has made a lot of research, who has made a lot of invention and brought in a range of products into the world market. So coming to this, as my portfolio includes the after-sales maintenance or after-sales service of this product, it plays an important role on how you maintain the handpiece in order to get the long life of it. So many times I get inquiries from the doctors, even during this exhibition also, they come to a booth and they ask like, I'm using your NSK handpieces, but still it keeps on getting damaged very soon. So you have a doubt on whether the product is not good or whether you're not using it properly. So there are certain do's and don'ts which you need to take care of. So this particular session, I'll just be giving you a brief know-how so that you know what exactly needs to be done when it comes to the maintenance of your handpieces. And this maintenance of handpieces holds good for your high-speed handpieces, which is your air rotor handpieces, for your low-speed handpieces, the straight, contra, surgery handpieces, implant handpieces, all types of handpieces. Not only NSK, but it holds good for other company handpieces also. Now, every dental handpiece has a designated lifetime, but unless and until you do the proper maintenance, unless and until you handle the product properly, you will not be able to get that long, the actual lifespan of it. So it's very important to do the preventive maintenance. Now, when it comes to preventive maintenance, we have the complete, the instructions mentioned in the operation manual. But honestly speaking, none of us have time and patience to read this. Okay. So to make it simple, I've just made it jot down in just 4 basic needs which will take care of the complete maintenance of your handpieces. Now, what are those 4 things? First thing is maintaining proper air pressure. The second thing is lubricating your handpieces properly. The third aspect is autoclaving as per standards. And the fourth one is using feather touch method. Now, what's about maintaining proper air pressure? It looks very simple, but it's a very important thing which many of us neglect to take care of. So what we say is, whenever it comes to maintaining air pressure, we from the company recommend you to check the air pressure which shows on your dental chair before operating on your patient. You may be feeling like, oh, I know my air pressure is set, the engineer has come, I don't need to worry. Yes, we agree that all the dental chairs are set with the proper air pressure, but there is a possibility of air leakage, there is a possibility of air droppage, depending on the time of usage, depending on the conditions of your dental chair. So it's very important for you to know what exactly is the air pressure which you need to maintain. So let's go a little bit in detail in this aspect. Now, how much should be the air pressure? Depending on the pressure gauge which you have on the dental chair or separately on your cuspidor or wherever, every dental chair has some indication of the air pressure. If you're using a normal handpiece, when I say normal handpiece, it's a direct type which connects directly into the tubing of your dental chair. So if you're using such type of handpieces, you can go to the range of 2 bars to 2.2 bars. If your pressure gauge shows the indication in MPa, then you can go to 0.2 MPa to 0.22 MPa. If your pressure gauge shows the indication in PSI, then you can go from 36 PSI to 40 PSI. So this is the indication of pressure which you need to take care of. So the range, it can be 2, it can be 2.2, but it should not be less than 2 or it should not be more than 2.2. Now, if you're using a higher end handpiece in the sense there are optic handpieces which needs a coupling. So if you're using such type of handpieces, there you may go up to a range of 2.5 bars. So such handpieces can withstand a little bit higher pressure, which is 2.5 bars or 0.25 MPa. And if you're still going to a premium product handpieces, which is from NSK, we call it as titanium handpieces. Such titanium handpieces, Z series handpieces, you can still go up to 3 bars. But the basic handpieces, the most common handpieces, we recommend you to maintain the air pressure within 2.2. Now, when I say maintain the air pressure, what you should do? Press the foot control, connect the handpiece without working on the patient, see how much your pressure gauge indicates. If it's less than 2, either ask your assistant or the engineer in your clinic or call the company person to get it rectified within this range. If not, then your handpieces tends to get damaged very soon. If it's low air pressure, you will not know. You will tend to apply load. It will cause the reverse effect on the ball bearings and the cartridge of the handpieces will get damaged. If you're running at a very high pressure, there will be excessive load falling on the handpieces, because of which, again, the cartridges may get damaged. So it's very important to maintain this air pressure. Now, there is one more thing which you need to take care of. Depending on the compressor you're using, I hope all of you all must be aware by now that all the air rotor handpieces runs by compressor air. These are pneumatically driven handpieces. The compressor air should be pure. It should not have any impurities in it. Now, what do I mean by impurities? There are possibility of dust particles or how can I say, some oily particles, depending on the compressor, whether using an oil compressor or an oil-free compressor, there will be possibility of some moisture to get included in the airline and come into your handpiece. Now, how to get this checked? You can do a simple experiment or you can do a simple test before you start your operation. What you need to do is just take the tubing from the dental chair. No need to install the handpiece. Just take a white tissue paper, cover the tubing, close the water knob. Okay, do not switch on the water knob, just close the water knob, press the foot control. Only air should come into the tissue paper. If you see that your tissue paper is wet, or if you see some yellowish or orangish or blackish particles coming into tissue paper, that means the air which is coming from the compressor, it's not clean. So that means there is some impurities there. What to do? Call the engineer and get the compressor drained. Each and every compressor will have a drain valve which needs to be opened at regular intervals, depending on the make of the compressor. It may be once in a week, once in a month, or whatever. So you can do this practice maybe once a week or once a month just to ensure that the handpiece is just taking pure air. This test will ensure you not only the long life of the handpiece, but also to ensure that such dust particles doesn't go into your patient's mouth. So that plays a very important role. Get the air pressure checked with your engineer within this range, and also ensure that the air coming from the compressor is pure and free from impurities. So this will ensure that the proper input air pressure is always within the range and your handpiece is free from excessive or low air pressure. That's the first aspect. Coming to the next one, the most common mistakes or the most common problems which happens for the early damage of the handpieces, and that is lubrication. And when it comes to lubrication, we always emphasize on proper lubrication. All of us, I'm sure, we do the lubrication, but we do not know whether we are doing the proper method of lubrication. So just see these points carefully. Number one, shake the oil can well. But before that, I would recommend you to stick to good quality oil sprays. Now, this is a very, very important factor when it comes to long life of the handpieces. The handpieces should always be lubricated with a good quality oil spray. When I say good quality oil spray, from NSK, we manufacture our own oil sprays. There are some other oil sprays like Sirona, W&H, Bean Air. There are many such Cavo sprays, yeah. But do not go for oil sprays which are much lower in price, because all such oil sprays, the reputed oil sprays, it has a mixture of alcohol in it. So the mixture of alcohol ensures that when you lubricate, whatever blood particles, the debris which is there inside the handpiece, which has come after the operation on your patient, it will be flushed and thrown away. On the other hand, the low quality oil sprays, what it does is it will not clean these handpieces. Instead, it will just float on such areas and it will come out without flushing out this debris which has incorporated inside the handpieces. Okay. So first thing, use a good quality oil spray, then shake the oil can well. Very, very important, because all the oil sprays are compressed air. The oil is compressed with the air, and if you do not shake the oil can and just spray, it will be just more of air going outside. It will be just flowing of air, less of oil. So instead, shake the oil can. Second step, very important, keep the oil can upright. What mistake we always do is we take the handpiece, we bring the oil can to the handpiece, and then we spray. Actually, this is the wrong practice. Shake the oil can, keep the oil can in upright position, bring the handpiece to the oil spray, and then spray for 3 seconds. Very important. It's not just like psst and leave it. No. You bring it and spray for 3 seconds. During this time, cover the head of the handpiece with a tissue paper. Very important. You cover this head of the handpiece with a tissue paper, spray for 3 seconds, and see what's coming out from your handpiece. Unless you cover this with a tissue paper, you will not be able to know like whether it's pure oil coming out or whether it's debris or blood or whatever. So only when you cover it with the tissue paper, you exactly know what has coming out. If you see some blackish or brownish or reddish particles, repeat the procedure until you get clean oil coming to the tissue paper. Very, very important. Now, this practice, if done properly, then only you're sure that your handpiece has been lubricated well. Unless and until the oil comes out from the head and comes out as a clean oil into the tissue paper, then only it's properly lubricated. Okay? So this is the proper way of lubrication, which we recommend you to do. Next question. How frequently should we lubricate? Very, very important thing. So what generally we do? Many doctors, what they do, okay, I do not have much patient, maybe 1 or 2 patients in a day. At the end of the day, you lubricate and go, which means once a day. Some doctors, they say, okay, I did not use my handpiece at all. Once a week. Now, if possible, we recommend you to lubricate your handpiece after every operation. Again, if possible. If not, then at least we recommend you to have a practice of lubricating 2 times a day, minimum. Once after the morning session and second after the evening session. Okay? And every time before autoclaving. It's up to you whether you want to autoclave your handpiece after every operation or whether you want to autoclave your handpiece once in a day or once a week, because autoclave has nothing to do with the maintenance or long life of the handpiece, whereas autoclave it's only for the sterilization of the handpiece to ensure you that your handpiece is sterile before working on the patient. So you can autoclave after every operation or you can autoclave once in a week or once in a day. But whenever you autoclave, we recommend you to do an additional lubrication before autoclaving in the same fashion and then put the handpiece into the autoclave. Now, what is the reason we have to lubricate before autoclaving? It's very simple. The handpieces has something called as ball bearings inside. And there is some non-metallic particles, which in technical words we call it as a retainer, which is made up of a special type of plastic, which holds the ball bearing intact. Now, if you do not lubricate and put the handpiece as it is into your autoclave, the 135-degree steam will come in direct contact into the inner part of the handpiece, and it will try to melt this special type of plastic, which is the retainer, and thus, after each autoclaving, the life of your cartridge goes down by 5 to 10%. Whereas on the other hand, when you do the lubrication, there will be a layer of oil covering this ball bearing, thus protecting this particular retainer, that is the plastic, from getting affected by this steam which is generated during the sterilization procedure. So that is the reason we recommend lubricate 2 times a day and every time before autoclaving. Sometimes we get a question like a doctor's asking, do we need to lubricate after autoclaving? Of course, all of you all know, no need. You do not need to lubricate after autoclaving. After autoclaving, the handpiece is ready to use. You just tear open the sterilization pouch, connect it to the dental chair, check the air pressure, start working. So this is regarding the lubrication. So the first thing was maintaining the proper air pressure and getting your pure air into the dental handpiece. And number 2 is ensuring you're using a good quality oil spray and you're using the proper way of lubrication. Now, when it comes to lubrication, especially for NSK handpieces, different handpieces has different lubricant adapters. Please use the proper adapters for lubricating the handpieces, especially for the low-speed handpiece. If you do not use these desired adapters and if you just lubricate using an oil spray, the oil will never reach the required particles which needs to be lubricated. Or what I mean to say is the oil will never reach the head part of the handpiece unless and until you use these adapters. Where to find these adapters? Each and every handpiece box comes with this adapter. Okay, it's as simple as that. You just, and each and every oil spray from NSK comes with these adapters. So there are different adapters for different types of handpieces. Please make sure that you're using a proper type of adapter. In case if you do not have this adapter, please contact our distributor. They will be happy to support you with the required adapter. But do not lubricate without the adapters. Very, very important aspect. Now, how to lubricate? As I said, you just connect the lubricant adapter, mount it on your oil spray first, then bring the handpiece to the oil spray and spray for 3 seconds. If you're using a 4-hole handpiece, the smaller hole should be lubricated. If you're using a 2-hole handpiece, that is Borden 2-hole, you have to lubricate the bigger hole. Okay? So generally what we do is we point the tip of the oil spray to the hole of the handpiece. But from NSK, we have made the life of it much easier by bringing a new type of lubricant adapter for your basic handpieces. I don't know how many of you all have seen these adapters. In case if you have not seen, maybe today or tomorrow you can visit the DentMed stall, which we have it here. We have a samples of this for you to see. It's a very, very effective adapter where you don't have the hassle of connecting the tip of the oil spray and spraying the oil splashes out and all the stuff. You simply connect this adapter to the lubricant spray, bring your 4-hole handpiece and spray it. And this adapter ensures that the oil goes to the proper hole and the proper lubrication takes place and 100% of oil comes out from the head without any leakage in between. So this will ensure you that proper lubrication of the handpieces is done. Okay? So this is something new, only available with NSK. Of course, it's compatible with all types of handpieces, not only NSK, but these adapters are available only with NSK. So this is regarding the proper way of lubrication of the handpieces. Then comes sterilization. When it comes to sterilization, there is only one method of sterilization for dental handpieces, which is autoclaving. We do not recommend dipping your handpieces into any chemical solutions. We do not recommend putting your handpieces into ultrasonic bath. We do not recommend putting your handpieces into glass bead sterilizers. The one and only methodology of sterilization is autoclaving. So you can use B class, S class, whatever type of autoclaves you have, and put the handpiece in a pouch, sterilization pouch, and put it in autoclave. That will take care of the sterilization. Why we say you should not use chemical solutions, because the chemicals which you use will have a reverse reaction again with the retainers of the ball bearings, which will cause early damage of it. Why we do not recommend ultrasonic bath? Because the vibration of the water molecules will create the movements of the ball bearings, resulting into wobbling of the handpieces. Okay. Last but not the least, please use a feather touch method for cutting the handpiece, for cutting the tooth. The burst which you use runs at a very high speed of 400,000 revolutions per minute. So at such speed, if you apply load on the patient's tooth, there will be a reverse effect falling on the ball bearings and early damage of the handpieces will take place. So whenever you feel just by touching, if the cutting is not proper, that means it's not that a handpiece is damaged. It could be either the burr which you are using could have been worn out, or the air pressure which you're using, it may not be up to the proper limit, okay? But don't apply load. Try to implement a method of feather touch. Just touch and cut. So in simple words, we say cut with speed, not with force, okay? So when I talk about burrs, there is one more point which you need to take care of. Please use good quality burrs, okay? Always use a good quality burrs, ISO certified burrs, and ensure that the burrs which you're using can withstand a speed of at least 350,000 RPM. As I said, our handpiece runs at 400,000 RPM. There are many burrs in the market which is available at 150, 200, 250. So it will be written on the back side of the burr packet. Please ensure that you're using the proper criteria of the burrs. So that will take care of your handpieces. So whatever I've explained, it's mentioned in a single sheet. Use a proper lubricant nozzle for the oil sprays. Bring the handpiece to the oil spray, spray for 3 seconds until you see the black, until you get clean oil coming out from the handpiece into the tissue paper. Lubricate 2 times a day. Only way of methodology of sterilization is autoclaving, and use good quality burrs. So this, if taken care of, will cover up your complete criteria of working with the proper maintenance of the handpieces. So I repeat, just four things which you need to take care of. Maintain proper air pressure, get your compressor cleaned at regular intervals, lubricate your handpieces properly, use a good quality oil spray, and spray for 3 seconds. Use a tissue paper until clean oil comes out into tissue paper. The only way of sterilization is autoclaving. Do not use any chemical solutions or any other things. And every time before autoclaving, lubricate your handpieces. And lastly, use a feather touch method. Don't apply excessive load while operating. Okay? So if that's clear, then I just have some time. Yeah, okay. Yeah, that's all from my side regarding the maintenance of the handpieces. So I understand whether you're using NSK or whether you're not using NSK, whatever handpieces you use, these basic tips would definitely help you to increase the lifespan of the handpieces you change. Thank you very much.